All right, so hello everyone. Ryan Murchie here again, coming to you to show you how to do virtual Medicare 101 presentation. We've seen a tremendous amount of success here lately, reaching out to local financial advisor groups, property and casualty agencies, senior centers, medical groups, and a lot more. Really seems like everyone is very interested in hosting virtual Medicare 101s for their senior population. If you reach out to one of these groups and say, hey, would your Medicare clients be interested in attending a virtual Medicare 101? A lot of the time, the answer is going to be yes, especially in today's climate. So I want to show you how to actually set these up. Now, I use webex.com. There's a lot of other software out there that you may be more comfortable with using. One of the very common ones is Zoom right now, but I really like WebEx. WebEx seems to be the most easy for me personally, but if you're comfortable with Zoom, feel free to use that as well. But as you can see here, I'm on webex.com, and that's where you need to get to in order to obviously host a webinar. So you go to webex.com, and there's a link right here that says start for free. You actually don't even have to pay any monthly anything in order to set up a free account. So what you're going to do there is create an account. Okay. Now I've already created a account. So I'm not going to register again. But once you register and log in to webex.com, it's going to bring you to this home screen here. I'll click home screen again. Now, in order to schedule a meeting, you click on the home screen there. And the way to schedule a meeting here is simply by clicking schedule a meeting. Okay. So you're going to schedule the meeting and you're going to select the date, time, and audience for that specific meeting. Now it's going to give you a meeting type. I always recommend just keeping that the same. Meeting topic would be our virtual Medicare 101. Now the meeting password, you don't change that. You don't need to change that. You actually, as long as the individual that's trying to attend your WebEx has the link to the WebEx that you generate, you don't need the meeting password. So don't worry about changing that. You can just leave that the same. This is the actual date and time you want to schedule. And the agents that have come into the office that I've shown this one-on-one to, what we did is I just scheduled one, picked a random date and time, and then told them to go out and market that. So really, it just comes down to, don't put much thought into this. Just get in here, schedule yourself a future WebEx. Okay, well, June 25th at 11 a.m. So now, June 25th at 11 a.m., I have a schedule, and make sure your time zone is correct as well. Let's make a mountain time zone here. So now, June 25th since I changed it to mountain time, it switched to 9 a.m., so I guess that's what it's going to be. So now at June 25th at 9 a.m., I am going to be hosting a virtual Medicare 101 presentation. All you have to do here is schedule. Now, I do recommend putting your own personal email in here, because when you click schedule, that's going to automatically generate you an email with the link that you need to attend the WebEx. Now, you can always log back into webex.com and add emails and edit your meeting to add emails so WebEx sends the link directly to the individual, or you can just forward the email that you're going to receive once you schedule the actual WebEx. Okay. Now, I'm not going to go into that much further here. I just want to show you how easy it is. Yep, I just got a notification. The Cisco WebEx meeting that I've scheduled, it just emailed me my link that I'm going to need in order to actually host this virtual Medicare 101. And again, you can share that link with the financial or with the other professionals. If you don't have a group or a network group of individuals that have a relationship with and you've partnered with, please start working on that. And this could be a great tool for you to start building those relationships in your local market. Reach out to your financial groups and say, hey, would you like your Medicare population to have the opportunity to attend one of our virtual Medicare 101s? Same thing with the medical groups here in the local area. if you have any relationships with medical groups, whether that may just be the front desk gal. If you can talk to that front desk gal or guy and say, hey, we have a virtual Medicare 101 coming up. Is there someone here that I can talk to potentially send this out to your Medicare population? So it's all about more or less creating those relationships and hosting these virtual Medicare 101s, especially in today's climate, is a great way to start developing new relationships as well. So now that we have this, it's as easy as that. I mean, we've got the virtual Medicare 101 scheduled. All you had to do was register a free account, schedule a virtual Medicare 101, and then you have the opportunity. What I'm recording on today is WebEx. It's kind of nice because it will actually you can just start a meeting and then do a quick recording, which will save on your computer. So I use this WebEx software to actually record all my material that I need to share my screen for. So not only does it allow you to host virtual Medicare 101s, but it also will record any material that you need it to. So really nice there. So now that you know how to set up a virtual Medicare 101, it literally took me less than 5 minutes to explain that to you. Please schedule one for yourself. Go schedule one so you have one on your calendar, so you're forced to market that through your referral networks that you've established. And if you don't have established referral networks, this will give you a great opportunity to create those referral networks. Okay, so now that we're done there, I'm going to stop sharing this specific screen, and I'm going to go ahead and pull up the Medicare 101 presentation. Now, the reason why I like this Medicare 101 presentation is because it's completely unbranded. I've actually edited this pretty extensively. JSA actually created this, but I think I deleted about half of the slides out of this. There was just way too much information. This Medicare 101 is 24 slides long and should really only take you about 30 minutes. And remember, when we're going through any type of presentation like this with a live audience, we don't want to get in the weeds. Okay, that's the trick. Don't get in the weeds. Give them enough information to the point where they feel confident that they've learned something and that they trust you as an individual that knows what they're talking about in this market. As we're going through the presentation, we're going to ask those individuals for more specific information on your case. Call and schedule a one-on-one consultation. So I'll show you how to plug that in as you're going through the Medicare 101 presentation as well. You want to say you want to try and pitch the client to call or email you to set up a one-on-one consultation at least 2 or 3 times during the presentation. So if really the only thing they learn during this entire 30-minute presentation is to just call you to set up a one-on-one consultation, that's perfect. Okay, you can go into more details with them once you know their case specifically. So now I'm just going to go ahead and shut down and start our Medicare 101. Now I'm just recording this today so you have a more or less an idea of how someone else would go through this PowerPoint. No way, shape, or form am I saying that this is how you should do it. I'm just saying this is how I would do it. And if you have any questions or concerns, obviously feel free to reach out. Hello, everyone. Thank you for jumping on our Medicare 101 today. Thank you so much for joining us. If you're having any problems with audio or if you have any questions, please put them in the chat and I'll do my best to either answer those questions during the presentation or try and fix any problems that you may be having. So without further ado, let's jump right in here. First and foremost, I'll introduce myself. My name is Ryan Murchie. I own and operate RMA. I've specialized in individual Medicare products for over 10 years now. This is all I've done. So I'm hoping that I'm going to be able to provide you with some information today that's going to help guide you along this process. Medicare can be confusing, but if you have a resource that specializes in this, we can make it a lot easier for you. So feel free, if you have any questions specific to yourself or you would like to schedule a one-on-one consultation to go into more depth on your specific situation, please, after the presentation, reach out and schedule your one-on-one consultation. So today, our agenda is going to be I'm going to explain to you who's going to be eligible for Medicare, what your coverage options are, when you can enroll, and of course, we'll open it up for questions at the end. So let's go ahead and get right into this. So who is eligible for Medicare? Individuals that everyone is eligible as long as you have been a U.S. citizen for at least 5 consecutive years. You're age 65 or older. You can qualify for Medicare under the age of 65 with a qualifying disability. And any individual that is diagnosed with either one of these 2 diseases is automatically qualified for Medicare, and that's end-stage renal disease or ALS. So if you meet the top credential is really the most important. You must be a legal resident for at least 5 consecutive years. You're eligible for Medicare as long as you meet one of these key points: 65 or older, 65 of qualifying disability, or you have one of these 2 specific diseases that will trigger your Medicare eligibility. Once you have your Medicare eligibility, these are the different branches of original Medicare. You have A, B, C, D, and Medicare supplement. Now, I'm not going to get into too much into this slide because as we go through this presentation, we're actually going to be breaking down each one of these to give you a little bit better understanding of how each one of these branches work and what they do for you. The first one we're going to be talking about today is your Medicare Part A. Now, your Medicare Part A is actually what you have been paying into over the course of your career. If you've ever had to pay Medicare tax, that's more or less what you've been paying for. You've prepaid your Medicare Part A premium as long as you have worked 40 quarters over your lifetime. So if you've worked 40 quarters throughout your life and you've paid into Medicare, and again, this could be you or your spouse. So if you or your spouse have worked 40 quarters over their lifetime and paid into this, you get your Medicare Part A premium free, and you're automatically entitled to that once you meet one of those criterias, okay? Turning 65, under age 65 due to disability, or one of those 2 qualifying conditions, okay? So you're automatically enrolled into this as long as you've worked those 40 quarters. This is premium free. And what I want you to remember about Medicare Part A is that this is your inpatient coverage. Whether you're inpatient in a hospital, inpatient into a mental health care facility, a skilled care, whatever that may be, if you are classified as in an inpatient situation, your Medicare Part A is what's going to be covering that for you. Now, Medicare Part A doesn't cover all of those services in full. There are some gaps here. So obviously you want to take a better look at this, but your Medicare Part A, the thing I want you to remember is A, inpatient. Okay. So again, back here, your Medicare Part A is your inpatient hospitalization. Now we're going to get into Medicare Part B. Now again, Medicare Part B, you are entitled to this once you meet qualifications. Now, some individuals may actually need to enroll into Medicare Part B. Some individuals may be automatically enrolled into Medicare Part B. And some individuals may want to delay their Medicare Part B, okay? Because Medicare Part B is not premium free, okay? So there is a premium associated with Medicare Part B. The base premium, I believe, is $134 to $155. Don't quote me on that. Those numbers change every year. That premium could also be different because of your income. The more income you make, the more the federal government is going to have you pay on this. So for more instruction as to whether or not you need to enroll, whether or not you're automatically going to be enrolled, or whether or not you should delay your enrollment, feel free to call RMA. We'll set up a one-on-one consultation and we'll guide you through what you need to do here to either enroll or delay your Part B. But your Medicare Part B, your A was inpatient. Now your Medicare Part B is going to be your outpatient, okay? So with A and B, you have your inpatient and your outpatient health coverage, okay? Anything done in an outpatient setting will be covered under original Medicare Part B. So I'm not going to read all of these bullets you see on the slide, but if you get any care done in an outpatient setting, that would be covered under original Medicare Part A or Part B. Okay, so A, inpatient, B, outpatient. Now you know what is covered by original Medicare Part A and B. Why are you here today? Okay, why do you need to enroll into additional insurance? Why do you need to make a choice as to how to cover the gaps that you've heard about in original Medicare? Well, there are some major gaps in original Medicare, and really the best way I like to explain the gaps in original Medicare is more or less your Medicare Part A and B is an 80-20 cost share plan. Okay, so original Medicare will cover 80% of the cost. You're going to be responsible for 20% of the cost. Now, for the premium that you have to pay for just Part B of 134, again, don't quote me on that. I'm not 100% positive. I don't do these every day. But your Medicare Part B, I believe, is 134. For $134 a month, you're going to get 80% coverage on all your inpatient and outpatient healthcare services. Now, that's probably excellent insurance compared to what you have. But what you need to understand is that 20% that you're responsible for is uncapped. Okay? So the risk that you are running is a 20% uncapped maximum. So a 20% of a doctor office, a doctor, a primary care doctor could, the 20% cost share there could only be $20 to $30. But when you get into those major health events and end up with an open heart surgery or something major, that 20%, you could be responsible for a whole heck of a lot more. So what we're going to talk about today, and obviously what we do as independent insurance agents, is help cover that risk and make sure that you're not uncapped as far as what you could spend out of your own pocket. So now another thing that original Medicare doesn't cover is any outpatient prescription drugs. Okay, and it's very important when you're Medicare eligible to enroll into Medicare Part D. We'll just jump back a couple slides here. We're now going to get into this little guy right here, Medicare Part D. You see the little prescription drug bottle. Because our Medicare Part A, inpatient hospitalization, our Medicare Part B, outpatient health services, that's only covering us for inpatient or outpatient health services. It's not covering us for prescription drugs. And the federal government also says that once you're eligible for Medicare, you must cover your prescription drug costs at the beginning of eligibility, or you will be penalized. Okay, so it's very important, even if you're not taking medications right now, to enroll into a prescription drug plan just to at least avoid those penalties. Now, obviously, if you were to call RMA and sit down for a one-on-one free consultation and you don't take any medications, we can take a look at some zero to low premium plan options to cover your prescription drugs so you don't end up getting that penalty. Okay, but really what prescription drug coverage is it's prescription drug coverage. That's about it. Okay, so it's going to cover any medications that you are prescribed from doctors in either inpatient or outpatient healthcare services. So if you get a prescription and you take it to a pharmacy, you need to have a Medicare Part D plan in order to have any coverage for that. Now, I am going to get into a little bit more on prescription drug insurance and how it works, because one of the most common things that seniors know, and that, for some reason this term just sticks in everyone's head, is the donut hole. What is the Medicare donut hole? So that's actually what we're going to talk about right now. Okay, each prescription drug plan will have 4 different stages of coverage. The first stage of coverage that you'll have on a prescription drug plan is your deductible stage. Now, not all prescription drug insurance carriers will have a deductible. And again, in a one-on-one setting, we could see what prescription drug plan is going to be is going to offer you the lowest costs. But not all plans will have a deductible, but a lot of them do. So if you are enrolled into a prescription drug plan that has a deductible, the first stage of your coverage is that deductible. So you have to pay out of your own pocket, cover the deductible. The next stage that you're going to be in is called the initial coverage limit. Okay, so your initial coverage limit is $4,020. Now that $4,020 amount is the full retail cost of your medications. Once the full retail cost of your medications reaches $4,020, you have worked yourself through the initial coverage limit. Okay, so if your retail cost of your medication ever reaches the total amount of $4,020, you're going to fall into the prescription drug donut hole, or the next stage. Technically, we call it the coverage gap. Okay, it's most commonly known as the donut hole. Now, how the donut hole works is that $6,350 amount you see there is what you have to spend out of your own pocket to get out of the donut hole. Okay, so once you spend $6,350 out of your own pocket, you then will get out of the donut hole and you will be in the catastrophic coverage phase for the remainder of the year. Now, these coverage phases you see here, those are calendar year based. So they're going to reset every January. Okay, if you have any questions specifically on your medications, how your medications would work with this, if you're going to end up in the donut hole, this is really, we have the software to be able to input your medication specifically and tell you exactly whether or not you can anticipate to fall in the donut hole. So please, if you have any questions specifically on this, call RMA, schedule a one-on-one free consultation. We'll enter your medications into the software we have access to and show you exactly how much, or an estimated annual out-of-pocket cost for your medications across the board for all insurance carriers that offer this coverage. Okay, so it's really important, again, to get your Medicare prescription drug or Part D covered as soon as you're eligible for original Medicare. Because if you don't, you could face penalties. If you want more information on the penalties and how those work, give us a call. Okay, so that is your prescription drug insurance. So we've covered, real quick, I just like going back and re-referencing because the more I say something, the more it tends to stick in people's minds. So again, the thing I want you to remember about Medicare Part A is that's your inpatient hospitalization coverage. Your Medicare Part B is your outpatient healthcare coverage. Medicare Part A and B is good insurance. Okay, it is, but it's more or less an 80-20 cost share plan. So you're responsible for 20% of all costs for your health coverage with no cap. So that right there tells you, okay, maybe I should take a look at additional healthcare, products that are available for me. Your Part D is exactly what it sounds like. It's your prescription drug insurance coverage. We talked about the donut hole and how that works. Again, if you have specific questions here on how this may affect you, please call us. We'll go over that one-on-one with you. So now we're actually going to explain Medicare Part C. Okay, so Medicare Part C is Medicare Advantage insurance. And what Medicare Advantage is it really takes those three branches of original Medicare that we talked about previously, your Part A, inpatient, your Part B, outpatient, and your Part D, prescription drug coverage, and combines it all into one private health insurance product called Part C, or a Medicare Advantage plan. So we're going to go into that more. So again, these are offered by private health insurance companies, and it just combines all branches of your original Medicare, including your prescription drug coverage, into a zero to low premium plan. And with this, a lot of these insurance companies are able to offer dental, vision, hearing, a lot of additional benefits above and beyond what original Medicare will provide to you. So you probably see a ton of commercials on the TV. I know that I watch the Golf Channel and I watch The Price is Right. And if you watch either one of those two things, I can guarantee you've seen 1,000 commercials saying, call the Medicare coverage helpline and we can get you extra dental, vision, hearing, whatever that may be. Okay, when they're talking about getting you those additional benefits, they're actually talking about Medicare Part C or a Medicare Advantage plan. Okay, so we're going to talk about what you must be in order to be eligible for this. A Medicare Part C plan, you must maintain your Medicare Part A and B. So no matter what, you must continue to pay your Medicare Part B premium. You must reside in the plan's service area. Now, the Medicare Advantage plans are county-based. So if you live up in Larimer County, you must enroll into a Larimer County Medicare Advantage product. You can't get one of those Denver County plans because you don't live in Denver County. So you must enroll into the plans that are available to you, and the plans that will be available to you will only be available there in Larimer County. So you have to take a look at that. And obviously, again, if you want to take a look at all the health plans available in your area, feel free to give us a call. You also must not have end-stage renal disease. And then if you do, you're going to qualify for additional government resources, and we can help guide you through those as well. So for your Medicare Part C, your plan costs, okay? So you must continue to pay your Part B premium, but these are typically zero to low premium plans, okay? Now, if you have any questions as to how a Fortune 500 insurance company can offer an insurance product for zero to low premium, we can go into more detail with you one-on-one if you would like, but I can guarantee you these insurance companies are not losing money. The federal government more or less pays these private insurance carriers to administer your Medicare benefits. So these are subsidized by the federal government. The feds are paying your premium for the Medicare Advantage plans. If you want more info, again, feel free to call us. So the coverage on these plans, they're typically always going to have your prescription drug insurance included in it. So for zero to low premium, you can have your inpatient, outpatient, and prescription drugs covered. But typically what you're going to see are co-pays on services. Okay, so you're going to have a $25 copay to see a specialist, or $160 copay days 1 through 5 if you end up in an inpatient hospitalization setting. So these are more or less a pay-as-you-go structured type of policy that has a bunch of extra benefits well above original Medicare, like your dental, vision, hearing type of coverage. Again, included in the plan at zero to low premium. Now, your Medicare Advantage plans, there's really 3 different types of them here in the state of Colorado. You have your HMO products, your PPO products, and your special needs plans products. So your HMO, what that means is that an HMO plan for all routine medical services, you must stay within the health plan's network. So if you're in an HMO, you have to stay in network for all your routine medical care. Okay, so if you're comfortable with staying in a network, I would recommend these type of plans, because the HMO plans, since they are network-based and they're managing your care, they're going to offer you lower copays and better benefits because there's a lower cost to the insurance company to administer these products because you're staying in a network of providers. Now, with the PPO plans, the PPO is going to offer you more flexibility, because with a PPO plan, you're going to have in and out of network coverage. Now, if you need that network flexibility, then you're probably going to pay more in most situations for your copays, and you may have smaller benefits for those dental, vision, hearing type of things. But if you require that network flexibility, there's going to be plan options available for you that will offer you the network flexibility. And then also you have special needs plans. And what special needs plans are plans specifically designed for individuals that have Medicare and Medicaid. We call that a dual eligible plan. There's also plans specifically available for individuals with diabetes. We call those chronic illness plans. And then there's also plans specifically designed for individuals that are institutionalized in a skilled nursing setting. We call those institutional plans. So there are 3 different types of special needs products. We're not going to get into that too much today, but I want you to know if you have Medicare and Medicaid or diabetes, or if you're institutionalized, there may be a plan that's specifically designed for you. Okay, so that's Medicare Advantage in a nutshell. Now we're going to get into Medicare supplements. Okay, so these are very common, very, very well known. Okay, MedSup, Medigap, Alphabet Soup plans, whatever you may have heard about them. But these have been around since original Medicare has been around. Medicare Advantage plans, they're a little bit newer. They came around in the early 2000s, or they became popular in the early 2000s. Medicare supplements have been around really since the legislation was passed back in the 1960s. So these are very well known, very common. And what a Medicare supplement insurance plan is It's a secondary insurance policy that covers the gaps of original Medicare. So remember, on your Part A and Part B, that being an 80-20 cost share plan, well, what the Medicare supplement is specifically designed to do is come in and cover that 20% that original Medicare is not. Okay, so it's secondary insurance sold by original Medicare. There's a lot of different plan options available, A through N, and some high deductible products as well. Our most popular Medicare supplement plan is the Plan G. It's going to offer the lowest, a really competitive premium, as well as some really good coverage where the client, you would only have to pay your Part B premium, and then the rest of your medical coverage is covered in full, okay, for inpatient and outpatient services. Now, these plans are available to you, but they're expensive, okay? What I like to explain for Medicare supplement plans, over about a 10-year period, you're going to pay about $25,000 in premiums for a Medicare supplement and a prescription drug insurance plan. Okay, because you can't just purchase secondary insurance to cover the gaps in Medicare, because remember, this is only covering the gaps of A and B. It's not covering your prescription drug insurance. So you must purchase a Med Sup and a prescription drug plan. And those combined premiums over a 10-year average typically run around $20,000 to $25,000. Okay, if you're comfortable with paying that premium over the course of the next 10 years, this is a very, very good product for you. There's not going to be a network of providers that you have to be subject to. And then also, more or less, you just pay your Part B deductible, and you just, pay your premiums, and you don't have to worry about medical out-of-pockets. So again, a Medicare supplement is a secondary insurance plan that's going to cost you, but it will fill the gaps of original Medicare, and it won't subject you to a specific network of doctors. You can go to any Medicare-approved doctors across the country. So these are very competitive options, or very popular options, really, throughout the state of Colorado, but so are the Medicare Advantage plans. And really, for you to understand which one of those two options is going to be better for you, give RMA a call, and we will set up a one-on-one consultation to go in depth as to what plan may best suit your specific needs. Okay, so now we're going to go, we already talked about this a little bit as we went through the presentation, but we're going to recap. Okay, so Medicare Part A and B. Remember, A inpatient, B outpatient. The Medicare Part A and B is what you worked 40 quarters in your lifetime for. You've paid in. Medicare Part A, you don't have any premium. Medicare Part B, you have a small monthly premium that's typically deducted right out of your Social Security check, okay? But you must maintain Medicare Part A and B to qualify for either option 1 or option 2, okay? So your original Medicare, your option 1 to cover what original Medicare doesn't, is to purchase a secondary health insurance plan or a Medicare supplement to fill the gaps of original Medicare, and also add on a standalone prescription drug insurance plan. So if you take option 1, you'll have 3 different coverage cards, okay? Your Medicare card will be your primary health insurance. Your Medicare supplement card will be your secondary health insurance, and you'll have a prescription drug insurance card to cover your prescription drug insurance, okay? Now, option 2 is a Medicare Advantage product. What a Medicare Advantage product is, again, real quick, is it combines all branches of original Medicare into one private health insurance plan. Now, typically, it's more of a pay-as-you-go, and it's also typically network-based, so you need to stay in a network of providers. But if you choose this option, you'll have one coverage ID card for all healthcare, inpatient, outpatient, or prescription drug insurance. You'll just carry your one card with you, and you'll be covered for everything. Okay, so that one card will take care of you for inpatient, outpatient, and prescription drug insurance, and then also throw in some extras a lot of the times, like silver sneakers and dental, vision, hearing, transportation, catalogs, all these different type of things you always see on the commercials. Okay, these are the plans, the Medicare Advantage plans, that are going to offer those benefits to you. Okay, so now we talked about A, B, C, D, and Medicare supplement. One of the last points we're going to talk about is when can you enroll? And really, your initial enrollment period is the most important stage to determine whether or not you need to enroll at 65. Okay, there's a lot of individuals that may not enroll at age 65, and we'll get into that in the next slide. But if you're turning 65 and you're already retired, you want to elect your Medicare benefit, you have 3 months before, the month of, and 3 months after your 65th birthday to enroll. Now, I do not recommend waiting until your 65th birthday month or after your 65th birthday month to work on this. You have 3 months prior to your 65th birthday month. That's when you should start working on this. And obviously, if you have any questions as to how to enroll into B, if you need to enroll into B or you're going to automatically be enrolled, just give us a call. We'll be able to help you through that situation. But you have 3 months before, the month of, and 3 months after to enroll into Original Medicare and select either option 1 or option 2 for your additional health care coverage. Okay, but what if you're working past 65? And this is really one of the most common things. We're seeing this very, very commonly because our Social Security retirement benefits typically aren't maxing out until age 67. So a lot of our individuals are waiting to retire until age 67. So what if you're still working and you're still covered under your employer group plan? Well, if you're still covered under your employer group plan and it's a large employer group plan, that may be considered creditable. Okay, that's the key word. You want to talk to your employer and ask them if your group insurance plan is considered creditable by Original Medicare. If they research that question and come back to you and say, yes, our group insurance plan is considered creditable by Original Medicare, then you're okay to delay your enrollment into Medicare Part B. And again, if you have questions on your specific situation, give us a call. But if you're staying employed and you're staying on your creditable group insurance, you don't have to worry about Original Medicare. You can delay your enrollment. Once you retire, you will then have a 7-month window to enroll into Medicare at that point and elect either option 1 or option 2. Questions specifically on your situation, give us a call. Now, there are some other situations that individuals can make changes throughout the year on their health care insurance. The big one that we see that really your mailboxes probably fill up every year. You may get some phone calls, but really the commercials run nonstop. I think one specific insurance carrier, I can't name names during this presentation, but one carrier has a 24/7 infomercial running from day to night, all day, every day, all the way through the annual enrollment period. Okay, so the annual enrollment period is really where you see the vast majority of the marketing happening. And that's because that's really the only time of the year, barring a special circumstance, individuals on Medicare can make a change on their health insurance. Okay, so in order to take a look at what the new plan options are available for the next year, and shop those plan options and see if they may be a better fit for you, you do that during the annual enrollment period. So if you're on a health plan now that you're not a real big fan of and you want to take a look at your options for 2021, give us a call and we'll schedule an appointment for you for a one-on-one consultation during the AEP. So you can take a look at the new plans for next year and see if those may be a good fit for you. There's also the open enrollment period. And that's really for individuals that have enrolled into a plan, maybe through a telesales team or just kind of blindly by searching through the internet and clicking and enrolling through the computer without really understanding what they're enrolling into. Okay, this happens quite a bit, unfortunately. So let's say you enroll yourself into a plan for a January 1st effective date and you don't like it. You figure out, oh no, the plan I enrolled into doesn't cover my medication. It doesn't have my doctors in network. What did I do? Okay, so the open enrollment period is the first 3 months of the year, and that really allows you to double check and make sure you like the health plan you elected during the annual enrollment period. And if you don't, you can make a change. Okay, there's also special enrollment periods. There's a lot of different special life circumstances that may trigger an opportunity for you to make a change. If you think you may have a special circumstance and you want to make a change, give us a call and we can work through that with you. So now I'm going to go ahead and open it up for questions. please go ahead and chat those. Please type those in the chat box. I'll be watching that chat box. So go ahead and enter all your questions in there. I don't see any questions coming in. So again, please, if you do have any questions, concerns, or you want a free one-on-one consultation with RMA, give us a call. We're here to help. We want to make this transition into Medicare as easy as possible for you, and we're really good at it. So let us help you. Give us a call or shoot us an email. We'll get you on the calendar. Thanks so much. All right, everyone. So that is more or less how to set up a virtual Medicare 101. And I ran through that PowerPoint presentation for you so you have an idea of how I like to flow through it. Now, again, that's not the perfect way to do it. There is no perfect way to do it. So make it your own. If you need to edit a slide or change a slide or delete a slide, feel free. But give me a call if you want a copy of the PowerPoint. I will email that right over to you. And if you have any specific questions on how to set these virtual events up and get marketing those, let me know. But this is the way of the future, everyone. So get on it. Get to work on this. Let me help you if you need it. Thanks so much.